Good afternoon, everyone. My name is Jeff Cooper, Health Commissioner at Public Health Dayton, Montgomery County. I'd like to welcome everyone again today to a news briefing on our response activities as a community around the COVID-19 pandemic. We're very pleased today that Commissioner Carolyn Rice from Montgomery County is joining us to make some comments, so welcome today. It's good to see you here again. We'll start with a little bit of review regarding Montgomery County's situation. So when you look at the statewide dashboard, the Ohio Department of Health COVID-19 dashboard, when you compare Montgomery County to other Ohio counties, a couple things really stand out in terms of the data. We are currently 12 out of 88 counties in terms of number of cases, confirmed and probable cases. We're 9 out of 88 counties in terms of, we're 9th out of 88 counties in terms of hospitalizations, and we're 23 out of 88 counties in terms of deaths. And when you look also at the long-term care facility list on the Ohio Department of Health website, you see that we only have 3 long-term care facilities listed of the many that are present within Montgomery County that have cases. So I think that speaks very well to the type of work that our entire community has done to comply with the stay-at-home order, as well as to help each other through this really difficult, unprecedented time. We've had tremendous community-wide effort from individuals at all levels to make sure that we're doing our part to slow the spread of this virus within our community. And when you look at our case rate compared to other metropolitan areas in the state, we are very low compared to the other major metropolitan areas throughout Ohio. So again, that speaks very well. One of the qualifiers regarding all of those data, however, are that there may be less testing to date that has happened within Montgomery County. And so we'll talk here just in a moment about testing capacity. So when the state of Ohio now begins to look at all of their trend data, we're seeing an increase in cases, and Dr. Acton from the Ohio Department of Health referenced that again today at Governor DeWine's news conference. We're still seeing an increase each day in cases. So it's a balancing act. We're beginning to reopen the economy, but we're also continuing to see an increase in reported cases, and we should expect that moving forward. Fortunately, we will have increased testing capacity throughout the state of Ohio, and the governor has alluded to this in his past news conferences. So between now and the end of May, we'll see an approximate 200% increase in the availability of testing capacity throughout the state of Ohio. So we'll go from essentially 43,000 test kits being conducted, or tests being conducted weekly, to about 133,000 tests being conducted weekly. And again, as that compares to the West Central 8-county region of Ohio, which Montgomery County is in, there'll be approximately an additional 1,000 or so tests being done each day for residents within that 8-county area. So no question, we should anticipate to start to see an increase in the number of cases being reported for Montgomery County. So we have to be very careful as we move forward reopening the economy. We need to make sure that we understand that the virus is still circulating, and we'll be able to demonstrate that by this increase in cases that are going to continue to be reported. And that's why it's very important for public health to build the capacity to do contact tracing. So as cases are reported, quickly identify those individuals, isolate ill individuals, identify everyone they came in close contact with, and then self-quarantine those individuals for a 14-day period. That's going to be very important as we move forward as a community. And we are especially concerned about congregate care and congregate living facilities. So our long-term care facilities and nursing homes, skilled nursing facilities, the jail, as well as homeless shelters. All of those type of facilities we need to be able to rapidly mobilize as a health department and do contact tracing in the event that we start to see cases. So regarding the stay-at-home order, the amended version of that is not available yet. We anticipate later today or tomorrow that amended stay-at-home order will end up on the Ohio Department of Health website. We know that beginning tomorrow, healthcare services that have been not operating will begin to resume, as well as dental services and veterinary services. On May 4th, manufacturing, distribution, and construction will begin again, those that were non-essential that are now going to be able to operate, as well as general office environments. And then on May 12th, consumer and retail. So I think we all understand that there are protocols that need to be in place for all businesses, not just those that are going to begin to operate again now, but those that have been operating all along. So all businesses. And we just need to become more comfortable with the fact that employees at all businesses are going to be required to wear a face covering. I think it's important to understand that employers can require, if they choose to do so, for customers to wear a face covering. And those face coverings don't need to be anything elaborate. They can be homemade, and many are. I think an important point to make is that it's not going to be possible for public health to enforce that protocol. So it's going to be incumbent upon each employer, each business to assure compliance with the face covering for its employees. And obviously, we're aware of the exceptions that are going to be made regarding health and safety situations, or whether it's not practical, and or if there's an industry best practice that says you should not be wearing a face covering. All of those exceptions need to be addressed by each individual business's human resources department. And so that's not something that public health can address. It's important to recognize, though, that face coverings really help all of us. No, they don't prevent infection with COVID-19. However, they help to reduce the spread of respiratory droplets and aerosols that we all release. So they help protect all of us. We need to also understand that those face coverings, they're not a replacement for social distancing. So all of the protocols that are in place for businesses, we have to continue to assure that we're social distancing and, to the degree possible, remaining 6 feet apart. And if it's not practical to do social distancing in certain settings, then barriers need to be installed. And that's pretty much laid out in the protocols set by the governor. It's also important to continue to do hand washing and covering our coughs and sneezes, cleaning surfaces frequently, not sharing work materials or products, as well as self-monitoring for symptoms. We all need to be doing that. And if we're ill or feel ill, go home and stay home. So other protocols in place for all businesses are going to be conducting daily health assessments for their employees, maintaining good hygiene, and we've talked about that, so hand washing and social distancing, cleaning and sanitizing surfaces, and then the new one for all of us, minimizing our occupancy or capacity in the work environment. So the actual protocol says 50% of the fire code, and do visits by appointment if possible. So this is just a new way of navigating through the business arena for all of us. And public health doesn't have an exemption from this. So for all of the facilities that we operate, it pertains to us and all of our employees as well. One last thing I'd like to mention about as these non-essential, now deemed essential businesses come back online, many of them have not been operating for multiple weeks. And so the Ohio Department of Health and the Ohio EPA have created guidance documents that we've placed them on our website regarding water restoration for those businesses and facilities. And so those guidance documents are intended to address stagnation issues with potable water, to make sure it's clean and healthy and sanitized for consumption. So those documents are on Public Health's website. And then the last topic that I would like to introduce today, or at least discuss today, pertains to what the governor has talked about the last 2 news conferences, and that is graduation ceremonies. And please understand that we at Public Health, everyone in this room, everyone in this community, recognizes that time-honored tradition for individuals graduating. So we, especially at Public Health, value the long-standing relationships that we have in place with our K-12 school systems. We've worked with school systems in this county on a multitude of public health issues for decades, and that's not something we would ever want to jeopardize. We also recognize that during this unprecedented time, significant challenges have been placed in front of schools as they try to navigate through this new normal as a result of this pandemic. Our governor and the director of the Ohio Department of Health have had to make some really difficult decisions around not just schools, but operating businesses, other environments, etc. But those decisions are intended to protect the health and safety of all Ohioans. And they're not difficult, they're not easy decisions to make. So we're all aware that there's a statement on graduation ceremonies that's been released by the Ohio Department of Health and the Ohio Department of Education. And it provides options on best practices. So our position at Public Health Dayton and Montgomery County is to comply with the spirit of the stay-at-home order as well as social distancing requirements. We strongly encourage school graduation ceremonies be virtual and or drive-through. Although an option, single-family in-person graduation ceremonies, unfortunately, they present challenges to ensuring the health and safety of participants as well as the sanitation of that indoor facility. So, it's obvious that there are multiple school districts throughout Montgomery County. And due to the wide variation in plans that are in place among those districts, Public Health, and we need to be clear about this, Public Health is not approving or disapproving any specific school graduation ceremony plans. We're simply stating our perspective of what we are recommending. I think it's also important to remember that the citizens of Dayton and Montgomery County have responded admirably to the stay-at-home order as well as social distancing. And that's despite personal, professional, and economic suffering and loss. And it's been occurring for quite some time now. And so we're simply saying we encourage our schools to continue to do their part as the stay-at-home order remains in place and social distancing requirements remain in place, and as the rest of the community continues ongoing sacrifices with respect to this pandemic. So we're all in this together. None of these are easy decisions to make, but we have confidence that our school districts will make the right decisions to protect their students, their faculty, and families. And then we would just like to echo what Governor DeWine has said regarding graduation parties. And we need to reinforce that gatherings of more than 10 people are still prohibited. So with that being said, we would like to welcome Commissioner Carolyn Rice to the podium.
Thank you. As many of you know, Montgomery County is in charge of our community's regional emergency management agency, which the Board of County Commissioners activated to assist public health, first responders, and our local healthcare system when this pandemic started. The Montgomery County Emergency Management Agency has requested that citizens and businesses donate clean, solid color cotton fabric and sheets to turn into cloth face masks. Donations can be dropped off weekdays between 8 a.m. and 4 p.m. at the St. Vincent de Paul loading dock on the south side of the building, which is located at 945 East Edwin C. Moses Boulevard. And I'd like to thank our partners here at Public Health who will be working with local sewing clubs to help transform these donations into cloth face masks that will protect essential personnel in the community. Now, as of this week, our Emergency Management Agency has shipped 252,032 items, mostly personal protective equipment, to 232 different organizations throughout the area. We've been organizing the collection and distribution of supplies and volunteers for several weeks now, and I just want to thank our team and the folks at St. Vincent's de Paul who have been helping us to do this work. You are truly making a difference for our frontline workers. I'd also like to mention several resources for those who have lost employment. Our information technology department has installed wireless internet in the parking lot of the Job Center for anyone who needs to access benefits like unemployment or food assistance. If you don't have internet at home, bring your phone, laptop, or tablet to the parking lot outside the Job Services door at 1111 South Edwin C. Moses Boulevard and connect to it'll be capital J, capital F, capital S, JFS, _public network for access. Companies are still hiring, and our workforce development team is working with people to find jobs and career opportunities. If anyone needs help finding work, call 937-225-5627. We also have a list of companies who are hiring online at www.thejobcenter.org. Now, using Human Services levy funds, we have provided $186,000 to help deconcentrate emergency shelters and reduce the potential for community spread of the virus among those who are experiencing homelessness. Medically at-risk shelter guests are now housed at 2 motels instead of in the shelter. The shelters have also increased temporary staffing for enhanced cleaning and disinfecting at both large congregate shelters in the area. During the pandemic, there is a heightened concern for victims of domestic violence due to the stay-at-home order in place. We provided the Human Services levy funding in the amount of $10,000 to Artemis Center to support services for victims of domestic violence, including bus passes, household safety items, hygiene supplies, and emergency food items. In closing, I'd just like to thank you so much for having me here today. I encourage citizens and businesses to visit our websites and follow us on social media for regular updates about services and programs. Our employees have continued to work through the pandemic to provide very vital services, and we will continue to do so in the weeks to come. Stay well. Thanks.
Thank you for those comments, Commissioner Rice. Unfortunately, 2 of our main presenters who are routinely here with us, Mayor Nan Whaley and Sarah Hackenbrack from the Greater Dayton Area Hospital Association, are not able to be here today. So with that, we would be happy to answer questions.
If any bars or restaurants open tomorrow, is there anything the county can do about that? Or?
So the question is, if any of the bars and restaurants open tomorrow, is there anything the county could do about that? So obviously, those restaurants and bars are still to remain closed, other than in terms of on-site consumption. They can continue, those that are able to do so, can continue carry out and delivery. And so that stays in place. And in the event that some choose to reopen prior to actual official approval to reopen by the governor, then public health would use the same process that it has used to date for other non-essential businesses that refuse to close. And so we would simply do our investigation and issue a cease operation order.
Where are we at with outdoor recreation, like in terms of basketball or any other like sport like that at parks?
So the question is, where are we with outdoor recreation and sport type activities? Obviously, the current, we've not seen the amended stay-at-home order. It's our understanding, though, that outdoor recreation, as defined in the current stay-at-home order, will still continue as long as individuals socially distance. So it's good exercise and go to parks and things like that. But as far as sporting events, those are still prohibited, and we don't have a sense yet from the governor and the director of the Ohio Department of Health in terms of when those will be permitted again.
But like non-organized sporting events, like you just want to go with your kids and play basketball at the basketball court. Like, is that allowed? Is that?
So technically, gatherings of more than 10 individuals are prohibited. Many facilities have actually closed those type of basketball areas. So until jurisdictions would begin to have permission for it again and open those, I'm guessing they're going to remain closed. Yep. Hi, Chris. Are you still on the phone?
I am.
Do you have any questions?
Yeah, I do have one. Mr. Cooper, do you agree with Governor DeWine's change of course on wearing of the face masks, and what would you tell customers in stores?
So the question is, does public health agree with the governor's change of course on face masks? I don't think public health is in a position to comment on the decision making made by the governor. We would simply say that it's required by employees, and we would encourage all individuals when in public and when visiting stores and other venues to wear a face mask or face covering.
And again, can you explain why it would be beneficial for both customers and the employees to wear face masks?
So obviously it does not, so the question is, why would it be beneficial for both employees and customers? It so if both are wearing the face covering, it helps prevent the spread of respiratory droplets and aerosols. So keep in mind, the purpose of the covering is not to prevent infection for the person wearing it. It's that if you cough or sneeze, etc., that you are releasing fewer of those droplets or aerosols that can potentially that someone else can potentially be exposed to. So it's simply it's one additional tool to help protect all of us. And if you look at some of the recent studies that have come out, Chris, some of the experiments and studies, it's pretty interesting that even a simple cloth face mask can really reduce what we expel when we sneeze or cough or even through breathing. Yes, they're not a surgical mask and they're not a medical mask such as an N95. They don't have that protective measure, but they really can help prevent the spread of droplets and aerosols.
Thanks. I have another question, unless you need to take one from someone else.
No, go ahead.
Are there any specific, okay, great. Are there any specific locations, whether it might be businesses or workplaces or otherwise, that public health is looking into that might be the source of positive cases attributed to other counties? In other words, are some of the cases in our immediate outlying counties, could they have been contracted in Montgomery County workplaces? Or are you aware of any situations like that?
So the question is, are there any areas where Public Health Dayton and Montgomery County is overly concerned regarding whether or not cases in Montgomery County or cases in another county may be linked based on those facilities? So Dr. Doan, Michael Doan is here and he'll start that conversation.
Hi, I'm Dr. Michael Doan. The question about cases and where they're sort of counted, they're counted in the point of residence for the person, but within we've talked a lot about there's the case, and then there's the case investigation and the contact tracing, so that within that, we find out that, somebody that's counted in Butler County actually works in Montgomery County, and that we may have a case in Montgomery County that relates to that. And we know the people that they work with who may also live, some of them in Greene County, so that the system by which those are investigated is comprehensive in terms of looking at the people and the relationships, not at where they live and not at where they get counted. So from that standpoint, I can say yes. The answer to your question is yes. There are people from other counties that are counted there that may well have contracted the disease in Montgomery County. Same way we got people living in Montgomery County that contracted it in some other county. So that you have to kind of look at the total picture and the total numbers, and that's why the contact tracing and the rest of that is so important.
I don't know that we have any hot spots.
I don't know, not hotspots. I mean, one of the concerns is that, as Commissioner Cooper said, our rate has been fairly low, and there are a number of reasons that might be the case. And as we get more testing, we may see that go up as we identify more cases. And it's not that that things are less out of control, it's just that we're going to be able to find them better. Whereas we haven't had the resources that some of the other larger cities have had to do that sort of work.
So specifically, how some of that contract tracing shown any specific location in Montgomery County to be a hotspot, so to speak, for people who might live in another county that work here?
I'd say no. I mean, first off, there's no definition for a hotspot. So, if you have two people in the same workplace, is that a hotspot? If you got a third person there, is that a hotspot within the same organization or something? I think it's one of the things to keep in mind is that they've done very careful studies on healthcare personnel who got sick. And they found that it was about 50-50, 55% of them that had COVID-19 disease got sick on the job in the hospital. 45% of them got sick through an exposure at home or someplace else. So that even though especially for the essential workers, we've got some people moving around and they're going to kind of concentrated places, and so those people, we're going to see them, and we see cases sort of cluster like that, but it may not be that it's that place. It may just be that that's a common place that these essential workers are active and that we happen to see them now. Does that make sense?
Right, but there hasn't necessarily been one specific place
Right.
or there or anywhere in the county where you're overly concerned about.
Yeah, that's right. I mean, there are so many, we think, asymptomatic cases out there. I mean, that's why we're asking people to wear the masks and all, is because there's just so many of us that may not know at this point that we have the virus and may never have symptoms in some cases. Which, if I can back up to something about the stores and the retail stores in particular, one of the sets of people I'm worried about are the clerks. At the convenience stores, it's one thing if you say, I'm just running out to get a quart of milk or something, and so you don't wear a mask and you just go get the quart of milk and you really don't see anybody else much except you check out at the convenience store, then you come home. On the other hand, the clerk that you saw in the convenience store is going to see hundreds of people that day, so that his or her exposure is going to be many, many times greater. And I don't want to see putting our kind of essential, everyday, buying bread and butter and milk and other sorts of things. I don't want to see those workforce people and those salespeople put at risk unnecessarily by some of us not protecting them by wearing a mask, because that's really what we're talking about. So, any other questions?
Thank you.
Hi, it's Tika Malagary with Dayton 24/7 Now News. How are y'all doing today?
Everybody says they're good. The question was, how is everybody doing today?
I have a quick question. I was wondering if there's any update on the court order that was issued in March to push eviction case hearings back until today.
I don't think, there's nobody here that has information about that. But that is an excellent question. Anything else?
Okay, thank you, everybody. Thank you.